And we're back live here at St. Joe's Hospital in Hamilton. We're right outside the OR. I'm Alex Anderson. I'm from Public Affairs, and I'm here with Dr. Anil Kapoor, the lead transplant surgeon that just finished the surgery. I'm also here with Dr. Darren Trelevin. He's the medical director of our transplant program. And we've been flooded with questions and comments, so thank you to everyone who's been sending those in. We're going to get to a few of those and address them both right now. But before we do, Dr. Kapoor, can you give me a play-by-play, just as you would for a sports game, about what just happened?
Well, much more important than a sports game, in my opinion, but it went fantastic. We were able to do the donor surgery without any hiccups at all, and the kidney looked beautiful. We were able to put it into the transplant without any problems. It made urine right away. So it was a 10 out of 10. It was perfect. There was no hiccups or complications we were worried about. The proof of the pudding is that it made urine right away, and so that means the kidney is already working, and we're very, very pleased with that and happy for the family.
That's wonderful. And so we know that Dr. Trelevin, you're a transplant nephrologist. Dr. Kapoor, you're a transplant surgeon. We had a question. How do both of you work together to actually bring this to life and do a transplant surgery for a patient in need?
Well, there's a lot of teamwork, so there's a lot of planning and meetings that have to go on to make this happen. So every transplant usually requires at least 4 meetings with the nephrologist and often 2 meetings with the transplant doctor, and we talk about any difficult problems ahead of time. It's mostly teamwork. Dr. Kapoor has his role and we have our role, and his is in the operating room. We like to help, as you see, keep him focused because we get great outcomes. We've got terrific surgeons.
We're lucky at our program in that we have a very collegial program. We work really well together. We've been doing this for as long as I've been here, 16 years now, where the nephrologists and the surgeons all work very well together. We're all good friends. We do the best outcomes for our patients, and the proof is in the results. We have one of the best results in the province, if not the country, for our transplant program.
So we had another question that came in online. Dr. Kapoor, can you tell us what is the fastest that you've ever done a transplant surgery?
Well, first I would say it's all about accuracy and not speed. We want to do the best job for our patients. So if it takes longer, that doesn't mean that it's not good. It takes longer because of complex anatomy. So first of all, speed's not the most important thing. It's accuracy. But the fastest I've done one is 45 minutes.
Wow, that's really fast. So we also have a Facebook comment asking...
It's a very skinny patient.
Less to dissect, yes. I'm learning. And then Dr. Trelevin, we have a question from Facebook asking, will the patient ever need another transplant after this one?
So Mr. Taraga is a young person, so kidney transplants from living donors, especially preemptive living donors, do the best. But it is foreign tissue, and these kidneys really usually last between 15 and 20 years. So we'd like to give him a normal life expectancy, so it's likely he will need another transplant. But this would be long in the future.
And then we have another question for you, Dr. Kapoor. What is the recovery time for the surgery, the patient after the surgery?
Sure. So the recovery for the donor surgery, we do it laparoscopically. So she's in hospital for about 2 days. Recovery is about 4 weeks or so. But it's important to remember that she's giving up a kidney out of altruism to her husband. So we give them as much time off of work as they want. If they want 5 years, we'll write it up. But it's really just a wonderful thing that these donors do. So we don't rush them in any way. But on average, they feel much better in about 4 weeks or so. The recipient, I should answer that, the transplant, that incision actually it may look painful, but it's actually not that painful. It's almost a little bit more than a hernia operation scar. And the surgical recovery is about 7 days, actually 7 to 10 days. But they require immunosuppressive drugs that may take 6 to 8 weeks to recover from everything they've gone through.
And so then we had a question actually directly from Sulphate High School about those drugs. So they were wondering, when the patient goes on anti-rejection medication, how does that work, and how long are they on that medication for?
So that's a great question. Shout out to Sulphate. And they need, and all the high schools watching. So they need to be on these medications for the whole rest of their kidney transplant life. So this is something that luckily is pretty easy to tolerate. There's 3 medications. They all work slightly differently. They keep the smart white blood cells called lymphocytes sleepy. They have some side effects, but most people can take them every day. Usually they're taken twice a day. Very important to take them twice a day and keep taking them. They have some chemical side effects. They can increase your cholesterol. They can thin your bones. Usually we have tricks to deal with that. The most important thing over time that both Dr. Kapoor and I do is to help monitor them for infections and other complications from being on immunosuppression. But luckily they don't get all infections because most of your body's immune system is still working just fine.
So throughout the entire surgery, we had people saying, wow, and saying thank you for sharing this, especially when that kidney turned pink and started producing urine right away. Wow, wow, so many comments. So what was this whole live stream experience like for you?
It was great. It was a great experience. I really enjoyed it. And again, I'm happy for the patients especially. There was some people saying, well, would you be nervous on the live stream? But we teach residents and medical students and fellows all day long. So we always have an audience in the OR. This is just an audience on Facebook. So it's really no stretch to do what we did today. It's been wonderful to educate people out there that are not in the OR, and hopefully they enjoyed coming into our OR today. It was a fantastic experience, and I loved it.
Wonderful. Well, you know, everyone has been saying thank you to the program, to both of you, to our entire team for making this experience possible. So on behalf of everyone, a sincere thank you to you both for your time, for making this possible, for us to be able to bring this to everyone who's watching. A big thank you to Salt Lake High School for sending in your questions. To all the high school students out there, wonderful questions. We've had great questions across Canada. We've had our past transplant recipients and donors thanking our program, thanking both of you who have been their doctors, and just, you know, saying this was a wonderful experience. So again, a big thank you to both of you. Thank you to everyone who's been watching. Keep sending your questions in. We do have team members on hand who will be answering them. So please do keep doing that. Tell us what you thought. And thanks again for tuning in to St. Joe's live stream.